Emory, and I'm going to be teaching you how to shoot an AP and lateral knee. You're going to start by getting a 10 by 12 cassette. I like to do my knees out of bucky if I can, so I'm going to do it tabletop. Depending on the size of your patient, if you have a larger patient with more soft tissue, you'd probably want to do it in the table bucky. On everyone, you're going to use a shield because we can shield for this examination. It's not going to obscure the anatomy of interest. You might want to use a caliper to begin with to measure ASIS to tabletop distance. That's going to determine what sort of angle you need on your tube. For this patient, I believe she's going to be about 16 centimeters, so we're probably going to angle caudal, 3 to 5 degrees caudal. Let's go get our patient. Miss Trawick?
Yes.
Hi, my name's Emory. I'm going to be taking your x-rays today. Can you tell me your full name and date of birth?
Hailee Trawick, 7/13/97.
Great. Is there any chance you might be pregnant? Okay, well, I'll have you lay on the table. Now you place the IR under your patient's knee, so 10 by 12, and you want to center it to about a half an inch below the patellar apex. You can then take your caliper, locate the ASIS, which is right there. You're going to go between the patient and the table. You want to measure ASIS to tabletop distance. Hers is right at 16. So we're going to place a 3 to 5 degree caudal angle on the tube. Now I'm going to place the shield in her lap, just across her pelvis like that. I want to make sure the IR is centered to about a half an inch below the patellar apex, and the same with the light. Okay. You want to make sure that your patient's foot is dorsiflexed. You're going to collimate down to about the size of the IR. You can collimate more, so it'll be about 8 by 12 or 8 by 11. Maybe a little less. And you can place your right marker, since this is her right knee, and just instruct your patient to remain still, and you're going to go back and make the exposure. So once behind the console, you'd set the exposure factors at about 75 at 4, and you'd take the exposure. On an AP x-ray of the knee, you should see the entire knee without rotation, the patella completely superimposed on the femur, and open femorotibial joint space with interspaces of equal width on both sides. Now we're going to move on to the lateral, and you ask your patient to turn on the side of the affected limb, so turn toward me, Hailee. I like to lift up the shield as they move. It can be kind of bulky. All right, you ask them to bring the unaffected limb over in front of the affected limb. This just places the epicondyles perpendicular to the IR. Ask them to flex their knee 20 to 30 degrees. I like to turn the IR so it's in line in the same longitudinal plane with the tibia and fibula. And you can turn your collimated light field as well. And on this, you're also going to angle 5 to 7 degrees, called cephalad. This just opens up the joint space and makes sure that the condyles are superimposed. You're going to center 1 inch distal to the medial epicondyle, which is about right there. And you'll place your right marker, and all that's left is the exposure. Once behind the console, you're going to set your exposure factors at about 75 at 4 or 5, and just make sure your patient remains still.
On a lateral knee x-ray, the fibular head and tibia should be slightly superimposed. The patella should be seen in lateral profile. There should be open patellofemoral joint space, and the joint space between the femoral condyles and tibia should be open.